Welcome. September is National Ovarian Cancer Awareness Month, and in honor of that, we have invited Jenny Steinke, Executive Director of the Ovarian Cancer Connection, to be our guest. Have you noticed the tear ribbons that are displayed all throughout our community? This is to draw awareness on the urgency of understanding ovarian cancer and its symptoms. The OCC is a strongly committed local organization with their heart and resources available for those women living in Northwest Ohio and southeastern Lower Michigan that have been diagnosed with ovarian cancer. It's time to get real about TL.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to. Children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at ToledoCardiology.com. That's ToledoCardiology.com.
At Ballast, there are no worries. Buy a certified pre-owned vehicle from Chevy, Buick, or GMC and you're protected. Because all those 2012 to 2017 vehicles come with 2 factory-backed auto warranties that combine to provide fantastic coverage. A new, longer 6-year, 100,000-mile powertrain limited warranty and an impressive 12-month, 12,000-mile bumper-to-bumper limited warranty, both with a $0 deductible. Ballast Buick GMC on the Central Avenue Strip and ballastbuickgmc.com.
Every day you listen to the news, but how is that news affecting your financial world? Things like your retirement and your kids' college fund. You need someone who can help you work towards that goal. Someone to help you move forward in these times of change. Call the Roop Prisby Williams Group at Morgan Stanley. Joel, Jim, and Deb each have 25 years of experience as financial advisors, and their team is right here in Northwest Ohio. To make an appointment with Joe, Jim, or Deb, call 419-842-6505. Investments and services offered through Morgan Stanley Smith Barney, LLC. Member SIPC.
Ugh, I'm breaking out again.
How about I make an appointment for you at Renaissance Dermatology?
Really?
Sure. They provide a full spectrum of medical and surgical services for a wide variety of skin conditions.
Mom, you're the best.
And they can teach you about skin care and how to avoid skin cancer.
Will it take long?
Nope. Renaissance is timely and efficient. We'll get you cleared up in no time.
How do you know so much?
See a big mole on my chin?
No.
There you go.
Call 419-824-2288 for an appointment. Renaissance Dermatology.
Welcome to Time Waits for No One. Again, we are talking about ovarian cancer. September is the month of ovarian cancer, and we are pleased to have you here, Jenny, again.
Thank you.
We met before, and we need to emphasize about how important is the mission of your organization. So, can we start with what is the Ovarian Cancer Connection mission?
Our mission is to raise awareness and educate the community on the early warning signs of ovarian cancer, and we also provide financial assistance to women that are currently in treatment.
So why it's important, to provide that awareness, for the ovarian cancer?
Well, ovarian cancer is kind of a silent disease that creeps up on you, and what we need to do is make sure that women are aware of their bodies. And the signs and symptoms are so vague that it can creep up on anybody. And the earlier that ovarian cancer is detected, the sooner that they can be treated, and the outcome is much better.
So based on that mission, are you getting a good results from that? Are you getting to the good outcome in general in this area?
We are. Over the past several years, we're seeing women are diagnosed at a much earlier stage throughout Northwest Ohio and Southeast Michigan because of the awareness. They're learning about their bodies, and we're out there pounding the pavement all the time talking about it.
So if we're talking about the ovarian cancer involved specific age of women, what is the age in general which is mostly involved?
Generally, it's women that are pre- and postmenopausal, the 50s and the 60s, but throughout Northwest Ohio, we have many women that are diagnosed at a very young age. We have teenagers, we have early 20s and 30s, and we're seeing that increase.
I remember that last year when we talked about one of the survival was a young, beautiful lady, and I'm glad that your organization was able to help her. So if we are talking about that orientation to the people about discovering that disease as soon as possible, what is the most common symptoms, which is, in general, you tell the people about?
Well, we talk about bloating. Bloating is common with women, but bloating is also a very common symptom of ovarian cancer. And we also talk about the urinary issues. They could have frequency or urgency of urine. We also talk about pains. Many women complain of abdominal pain or low back pain. And eating. They say, well, I eat a little bit and I'm full really quick. Those are basically the common symptoms that women have when they're diagnosed with ovarian cancer, but women experience that all the time. So we tell women, if it's something unusual for you, it lasts 2 weeks or longer, go check it out with your doctor. Chances are it's not ovarian cancer, but if it is, you want it to be caught at a very early stage.
So if there is a suspicion, I mean, what is the role of your organization to connect with those women? What should they do to reach out to you, to get educated more after they go to their doctor? Let's say that there is some suspicion of ovarian cancer.
Well, we're very close with all the physicians in the Toledo community, and they have the resources for the ladies to reach out to us.
Sure.
And when they do reach out to us, a lot of times it's just for more information or to find a different doctor for a second opinion. But the majority of the time, they're reaching out to us because they need financial assistance. And that financial assistance is so important to them because being a young woman or a woman of any age, they usually cannot work during this treatment and during their surgery. Or they're single moms and they have children at home. And they need to be fed, they need to get to their doctor's appointments on time and make sure that they're at every doctor's appointment and treatment appointment, which is crucial for their treatment. But when you hear a woman say, I haven't worked for 4 months and I'm going to be evicted from my home or my utilities are going to be turned off, that's really a sad situation, and that's where we can step in and help them.
So what kind of financial assistance you provide specifically?
Well, the one main thing that we see women ask for is assistance to get to their appointments. And if they have appointments scheduled, say, for the next 3 weeks, and the week before their next appointment, they will receive a $25 gas card in the mail from us. And we will continue that throughout treatment and for a few months afterwards for their appointments or follow-up appointments. We also help women with the utility disconnection, and we hear about the evictions. We help with that. There are times that they need assistance with their prescription drugs. They cannot afford their copay, so we help them, especially with their pain medications. They cannot go without pain medications.
Absolutely.
And then we also provide resources that are out there. We provide referrals to other companies or organizations that are out there that can help them.
And how do you get your funds?
We work really hard.
I'm sure you are.
We do that through a lot of fundraising throughout Northwest Ohio, and we're so grateful for all the donors that are out there. But I also want to share with you that we're all volunteers. Nobody is on payroll. So the money that comes in strictly goes just for our overhead and our fundraising expenses, but it goes back to the ladies. As of the end of July, we have provided over $82,000 in assistance. And I'm going to say probably 75% of that is in forms of transportation gift cards.
Unbelievable.
Yeah.
Unbelievable. You know, definitely that kind of mission is needed in town, and I'm glad that you guys are available and doing it. So if there's any specific events or, you know, programs soon you're going to have, so to let the public know about it, so they hopefully they can put in some kind of funds and donations?
Oh, that would be wonderful. We have an event on September 8th. It's a Saturday. In fact, we opened up a chapter of the OCC in Fremont.
Okay, great.
And a group of women, 4 women, met each other during chemo. And they have put this fundraiser, which is a 5K together, and doing a fabulous job.
Wonderful.
And then September 15th, we're having our walk, our major signature event here in Toledo. And that's at the University of Toledo Medical Center. After that, we're going to take a little hiatus, but our office still keeps going, but we're going to slow down a little bit on fundraisers because we've had 6 fundraisers in the last 4 weeks. So we're a little exhausted, but donations will come in throughout the year, and we're so grateful for those donations to keep our mission going.
Now, one item I want to touch base on is basically the people who doesn't have insurance. Are the healthcare system available in town helping you in providing some support for those patients?
Sometimes. We work with them very closely as much as we possibly can, but once again, it'll become a referral. I had a gal call me yesterday, and she doesn't have insurance, so I referred her to one of our local healthcare providers, and they are going to be able to help her out.
Good, perfect. And I shift now the attention to one of our survivor here, which is Lorraine Strau. Welcome, Lorraine.
Thank you.
And thank you for being here, and congratulations on being a survivor.
Yes.
How many years now?
10.
10, God bless. That's a good number, and
wonderful.
hopefully for many years to come. So tell me, Lorraine, about what was the first initial symptom led you to go to the doctor?
The symptom that took me to the doctor, in fact, to the emergency room, was significant abdominal and back pain. It was at that emergency room that I found out that I had cancer of some kind. When I look back now, I had other symptoms happening, and I didn't realize, as Jenny said, it was silent. The urinary issues, the back pain, but I didn't know. I attributed a lot of that to the fact that I was entering menopause.
Sure.
So that was confusing.
And after you went to the emergency room with that severe incident of abdominal pain, how long it took the professional to find out the diagnosis of ovarian cancer?
It was probably 4 weeks later that I got that diagnosis. In that 4 weeks, I had many scans and lab work, but I got the official diagnosis at the end of 2007.
And the treatment was designed at that point based on the stage of your cancer, I assume?
Yes, yes. I had surgery 2 weeks later, and 2 days following surgery, I started chemotherapy.
And how often you have a follow-up for, you know, with your doctor to check you on a regular basis to make sure that there is no recurrence for the cancer?
Well, currently, my doctor's recommendation is that I can be seen by him every year.
Okay.
I have actually requested every 6 months for the reassurance that I'm okay.
Yeah, this time you don't want to take any chances.
No chances.
So I want to go back to the time when you discovered that you have the ovarian cancer. I'm sure it's a shocking experience and not the best news you can hear from someone. Can you tell us exactly how did you feel about it? And what was the resources at that point to help you to overcome some of the shocking information coming to you?
Well, I guess what I did is I let my mind go to the famous people that I knew that did not survive ovarian cancer, and so it was a shock when I did that. I relied on the resources provided by my doctor and the office. Unfortunately, I was not aware of the OCC at the time. I wish I had been. It was later that I learned of that group.
And how, right now, you are involved with the OCC. Can you tell us how is your role as a survivor? How can you help someone who is now just diagnosed with that disease? Is it easier, you think, because you are telling them personal experience?
I don't know if it's easier, but I think I have things to share. I remember I had gone to our support group, Let's Talk It Over, and I was able to share some information about some symptoms that I had at the time of my diagnosis, but also that have cleared up.
Sure.
Things like that that I think maybe can give other ladies some hope.
Absolutely. And based on that now, you are, all of you, volunteering for the OCC and doing a great job, and I'm sure. So can you tell the people why they should support the OCC? I mean, it's an important mission, I have no doubt about it. But some people, they, oh, I give enough here and there. I mean, but I think it's in the community needed. So can you tell us something why they should support OCC?
Well, I think it's two-pronged. First of all, we're working to get the word out about the symptoms to be aware of. They're so easy to overlook, and we're constantly getting that out there. The other part of it is just, as Jenny was talking about, the help that we can provide financially for ladies that are going to struggle with financial issues during their treatment and beyond. So both of those, and the fact that we are totally volunteer, and that the money that we raise goes back to the ladies.
Absolutely. And I understand, Jenny, that's 100% the case.
100%.
There's no money going for overhead and employee and like some of the other organizations.
That's right, and we're an independent organization. We're not connected to a national organization.
Okay. I'm glad to hear that. Thank you very much. Congratulations on 10 years survival, and thank you for the good time and the good effort you are doing in the community, and I'm sure everybody appreciate your organization.
Thank you.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at ToledoCardiology.com. That's ToledoCardiology.com.
At Ballast Buick GMC, you can make luxury your reality in an all-new 2017 Buick LaCrosse, designed for the ultimate quiet and luxurious driving experience. Or picture your family in a luxurious, roomy SUV, complete with DVD system, heated seats, and a 4G Wi-Fi hotspot. Choose from the popular compact Buick Encore to the gorgeous Buick Enclave. We invite you to browse our website, ballastbuickgmc.com, or stop in soon. Remember, at Ballast, you are family.
Life is filled with uncertainties. Your career, your health, your family situation, they're all subject to change. So how can you plan for your future when you don't know what it will hold? The Roop Prisby Williams Group, a financial advisor team at Morgan Stanley, can help. Joel, Jim, and Deb will work with you to create a wealth plan and to help you manage your investments through all the changes. And the great thing is they're right here in Northwest Ohio. To make an appointment with Joe, Jim, and Deb, call 419-842-6505. Investments and services offered through Morgan Stanley Smith Barney LLC, member SIPC.
Honey, do you remember this mole being there before?
No, I don't. We better get that checked out. I'll call Renaissance Dermatology.
Didn't they treat your eczema?
Yeah, but they can handle the full spectrum of skin conditions. They can screen to see if it's a problem, and if it is, they can handle the surgery too.
Will it take long to get an appointment?
No, Renaissance Dermatology is timely and efficient. That's why I trust them.
Sounds like they know what they're doing. Go ahead and call.
5951 Renaissance Place in Toledo. Call 419-824-2288 for an appointment. Renaissance Dermatology.
As a follow-up for the same subject, we were discussing the ovarian cancer. And it's my pleasure today to welcome Dr. Jennifer Rode, who is an oncologist in Mercy System, and thank you for being here.
Thank you, it's my pleasure.
Thank you. We interviewed earlier today Miss Ohio, who was diagnosed at young age, 24 years old, with ovarian cancer. And the big question, which is really comes to the mind of most of the people, what is the best way to discover that kind of disease at the early stage?
So unfortunately, we have not been successful to any great extent in finding ovarian cancer in early stages. Unfortunately, probably 70% of women at diagnosis are stage 3 or 4. And we know that if they go back and think back, that there are some subtle symptoms that may have led to an earlier diagnosis. However, you know, again, unfortunately, ladies are still usually at an advanced stage. Especially in a woman that young, it would be unusual. The median age or the average age for discovery of an ovarian cancer is usually at around age 61, and so she's a very atypical situation. And I think even with presenting symptoms of bloating or urinary frequency, we would likely attribute to a more common young person's process.
And that's what happened basically with her. They misdiagnosed her for a short period of time before they get to the right diagnosis after that. So what are the most common symptoms?
A lot of ladies will present with abdominal distension or bloating, and that's typically related to the presence of ascites or buildup of fluid in the belly. But earlier symptoms could potentially be related to a pelvic mass or an ovarian enlargement. And again, that would be things like urinary frequency, change in how the bowels are working, or the size or consistency of bowel movements, a fullness sensation.
And most of these symptoms, sometimes when the patient feel it, should address it with their family doctor, and when there is no recovery, I'm sure it's better to go to a specialist where they can make the appropriate testing or do the appropriate testing for them.
Yes, if they have persistent symptoms or progression in symptoms and they're not getting the answers that they feel are correct, they certainly should pursue that with an additional provider or somebody else to evaluate. I can't tell you how many times I've taken care of ladies who had vague gastrointestinal symptoms, had imaging for their gallbladder and all these other kind of things, but the problem was really lower and was not seen on the scans and images they had.
If there's any specific test needs to be done for people with high suspicion for ovarian cancer, you recommend?
Well, the best way to evaluate the ovaries is with ultrasound. Even though it's old-fashioned, low-tech technology, it really is a very good way at looking at the ovaries. You can see good characteristics. Is there a cyst present? Does it have abnormal blood flow? Is there fluid collection in the pelvis that can be a sign of a malignancy? Are there nodules in the cyst wall? But the characteristics that we see on ultrasound give you a good idea of what's going on.
So if we want to educate the public about the stages of ovarian cancer, you just mentioned that most of the people get discovered at stage 3 or 4. Do you mind to give us what does it mean, stage 1 or stage 4?
Stage 1 ovarian cancer, the abnormal cells are confined to one or both ovaries. If it spreads to the uterus, the fallopian tubes, or the tissues immediately that are present in the pelvis, that would be a stage 2. However, if it is spread up to the omentum or into lymph nodes, that is stage 3, or if it's in the upper abdomen. If it has involved the lungs or the liver, then that would be stage 4.
And the treatment?
So most commonly, if it's stage 1 disease, surgical treatment may be all that is necessary. But I do caution that if a surgery is done to remove an ovary or to do a staging, we know from research that that is best done in the hands of a gynecologic oncologist, even if I'm tooting my own horn, because if ladies have staging with a regular OBGYN and perhaps have a surgeon or a urologist come in to sample lymph nodes, we've found that they just do not have as comprehensive a staging and do not have as good of survival rates and outcomes. And then from there, there are guidelines set up by the National Comprehensive Cancer Network, or NCCN, as far as chemotherapy. Typically, advanced stage ovarian cancers are more likely to be treated with adjuvant chemotherapy as opposed to radiation therapy. And we know, again, from recent research and data, is that if a woman can tolerate it and if she is a candidate, then putting the chemotherapy directly into the peritoneal cavity with an intraperitoneal port is one of the best ways to get good long control and good long remissions.
That's the latest I heard, it's probably. Correct. And how is it done here locally? I mean, are we doing that procedure, that intra-abdominal chemo?
I am just getting here and getting started, and certainly have spoken with the local medical oncologist and am planning to provide the placement of the intraperitoneal catheters and work with them to provide that service for women who are candidates. But again, I do want to caution that not every woman would be a candidate for that particular type of treatment, but certainly we will be looking for folks that are served by that.
The specialist who can make that decision and judgment. So with your experience and what's your advice to everyone about protecting themselves, hopefully, I mean, from having that disease or being victim of that disease?
Well, that is a very tough question to answer. Currently, about 24,000 women are diagnosed with ovarian cancer in the United States each year. So compared to the over 200,000 women who suffer from breast cancer each year, that's low numbers and low percentages. However, it is a devastating disease. Again, it's typically advanced stage when it's found, and because of that is more of a disease that we control as opposed to cure in a lot of instances. However, the data has been very mixed about doing routine population screening. It seems that women who are high risk for ovarian cancer are probably best served by some type of screening, such as doing pelvic ultrasounds and the CA-125 blood test every 6 months is one of the protocols that we use for ladies who are BRCA gene positive.
And who are those people who are at higher risk for that disease?
So again, there is a genetic screening test that looks for a mutation in the BRCA1 or 2 genes. If there is a strong family history of ovarian cancer, if possible, the woman who is affected with the cancer should be tested for a gene mutation, and any of her blood relatives should also be tested if she does test positive. And then those women would be appropriate for screening until they reach an age where perhaps they are done with childbearing and would want a preventive surgery. and removal of the tubes and ovaries. But for screening, again, typically it's a combination of pelvic ultrasound and CA-125. But even that is not perfect. I personally have taken care of patients who are on that program, who are not quite ready to have a preventive surgery. And at the first sign of any abnormality on ultrasound, I had one lady that when we did her surgical staging was already stage 3. So, you know, again, we're certainly always on the outlook for better ways to screen and better ways to pick it up at an early stage. But it does seem that screening every single woman right now is
not that simple,
not warranted, or you know.
But it's still, at least when there's someone having symptoms persistent the way you described it and not able to find the appropriate answer, is better to seek a specialist attention where they can look into the situation, do the appropriate testing, and probably decide about the appropriate fast treatment, because it's definitely, it makes it different to have the time on your side.
Absolutely. And again, women who are diagnosed in early stages are quite curable. Absolutely. And we just have to get better at finding it.
After that.
Absolutely.
If it's early stage. Great. Thank you very much, Dr. Jennifer Rode. It's my pleasure to welcome her in town. I think that she just moved here, and welcome to Mercy, and thank you very much.
Thank you. I appreciate your time.
You're living a full and productive life because you've always committed to giving the best of yourself to everything you do. And there's so much to look forward to: children's weddings, the second honeymoon, your philanthropic work, just to name a few. The dedicated physicians at Toledo Cardiology Consultants are committed to your cardiac excellence, so you'll be there for the experiences of your lifetime that are yet to come. To learn more, visit Toledo Cardiology at ToledoCardiology.com. That's ToledoCardiology.com.
Thank you for spending time with us today. As you drive through town, take time to notice all the tear ribbons and what they stand for. Information about today's program and how to contact the Ovarian Cancer Connection will be on ToledoCardiology.com. Learn and go to your doctor if you have any of the symptoms we discussed today, because time waits for no one. Sitting is the new smoking. From the office chair to the car and then the couch at home, people are spending too much time sitting, and it's hurting their bodies. Researchers have found that sitting is more dangerous than smoking, and we are sitting ourselves to death. The solution? Move more, play more, dance more, make love more. Find ways to get 10 minutes of movement as many times as you can a day. Remember, time waits for no one.